Thank you, Margie. We have a doctor in the house this morning, Radhika Smith.
Hi.
How are you?
Good, how are you?
I'm good. We're here to talk about a very important thing that a lot of men need to get done, and that's colonoscopy, because it's a cancer. Colon cancer is something that affects a lot of people nationwide. How many people are impacted by this?
It's one of the most common cancers that affect both men and women, so surveillance and screening are of paramount importance. It's really important that you talk to your doctor if you have any symptoms.
How many people are impacted by colon cancer, you think, on a nationwide basis yearly?
Hundreds of thousands of people, both colorectal, both colon and rectal cancer.
Second leading cause of cancer deaths.
That's correct,
That's
yeah.
alarming.
But the great part about it is that in a lot of instances, it can be preventable with routine colonoscopy.
So how do we convince men who may be a little hesitant to go get that colonoscopy? Because it's something that when you get to a certain age, better sooner rather than later, right?
Sure, so I think the most important thing is we make sure that patients know that if they're having any symptoms, so that would be blood in the stool, change in their bowel habits, anything that really is alarming to them, that they talk to their doctor. Because most of the times it's not colon cancer, but it does need to be evaluated. The other thing is that physicians and patients should really be aware of what screening guidelines are. So anyone over the age of 45 who does not have any family history risk or other risks should consider getting a colonoscopy and having those done routinely.
That's if they don't have that. Now, what if they do have a history of that?
Sure.
They go ahead and get it done quicker?
Yeah, if you have a family member that has a diagnosis of colorectal cancer, definitely talk to your doctor, because for many patients, that may mean that they come in 10 years earlier and that they have their colonoscopy more frequently. So rather than having it every 10 years, you may need to go every 5 years.
Okay, and then we're going to wrap this up, and I appreciate your information you're sharing with us, because this is something that we all need to be aware of.
Absolutely.
As far as males, myself included. You're over at Washington University, you're a physician. Why is it important for you guys to continue to remind people to continue to follow up on this stuff?
So it's so important because the benefit of colonoscopy is not only can you diagnose a cancer potentially at an earlier stage where then it's more curable, but you can also prevent colon cancer by removing polyps. And just to be really clear, it's men and women. So anybody who has a colon can get colon cancer.
Anyone can?
Yes, yeah.
Oh, wow.
Absolutely.
I'm embarrassed to say that I didn't know that, but I'm glad to say that I did just learn that. So
Yeah,
thank you
that's
for
why I'm here.
Yeah, that's why you're here. That's why you're the doctor and I'm the news guy. All right. Well, thank you for joining us, Dr. Smith. We appreciate it.
Absolutely.
That's all the time we have for the interview, and we'll go ahead and send things back to Margie.